My name is Kate Elder. I work with the International Federation of Red Cross and Red Crescent Societies here at our headquarters in Geneva, and I'm the immunization focal point. So I work with our field network and our national societies to help improve immunization around the world. I also work with the Gavi Civil Society constituency, and I chair our CSO steering committee. So the IFRC plays a very large role in immunization, and particularly through the role of Red Cross and Red Crescent national societies, through our network of 186 national societies around the world. We believe that the role of community-based volunteers is quite important in maximizing what vaccination can do to improve health of communities and countries. So national societies mobilize their volunteers to create demand in communities and to reach people which otherwise wouldn't be reached through vaccination efforts. We play a role in large vaccine-specific initiatives, such as the bid to eradicate polio or to eliminate measles, but we also work on a longer-term community-based approach to help improve routine immunization in communities. So really our role is to make sure that, that mothers and caretakers know the value of vaccines, know where they can access them, are really demanding that vaccines come to their communities, and when vaccines are available, making sure that people are using them and getting the most bang for the buck out of them. Immunization and vaccines play a very important role in the common global health agenda. The MDGs, the Millennium Development Goals, which have been agreed upon by the global health community, really set the framework for what we're collectively working towards as a global health community. And one specific MDG, MDG 4, is to reduce child mortality by 2/3 by the end of 2015. Vaccines contribute significantly to this goal, not only by reducing child mortality, but also by preventing disability and disease, which would harm a child or compromise their potential. So vaccines really have a lot to contribute towards reducing child mortality. Some examples, the Global Measles Initiative, which has introduced measles vaccines in least developed countries, has achieved a significant reduction in measles mortality. For example, over the past 10 years, there's been a global reduction of measles mortality by 78% around the world. That's quite an achievement. Children are no longer dying of measles. Specifically in the Africa region, measles mortality has been reduced by 92%, which means that where there used to be hospital wards filled of children affected by measles, they're no longer there. This is more children who are able to fulfill their potential. So examples of two vaccines where we could significantly reduce child mortality are pneumococcal vaccine and rotavirus vaccine. Pneumonia and diarrhea are the two leading contributing factors to under 5 mortality, to children dying. And now we have vaccines against those two diseases, which could save an additional 800,000 lives each year against pneumococcal disease, pneumonia, and an additional 200,000 lives each year against diarrheal disease, against children dying of diarrhea. So we have these vaccines. Now our challenge is figuring out how to raise the funds so that they're introduced in countries where children are really dying of these diseases. That's our challenge, and it's also our opportunity. So in relation to the MDGs, the Red Cross and Red Crescent plays a very large role, not only in vaccines, but in major other diseases such as malaria and HIV. Particularly within vaccines, we play a role to reduce vaccine-preventable diseases in countries through the Red Cross and Red Crescent network, and also at the global level by bringing awareness to the fact that vaccines are available, they're a best buy, and they're really a miracle in terms of improving health. So last year, in September of 2010, the UN held a high-level MDG summit in New York, and there the IFRC organized an event on polio eradication and some of the lessons learned that could contribute towards achieving other MDGs, and particularly the health-related MDGs. At that event, we launched our advocacy report, Immunization, Unfinished Business, which I would encourage everybody to read. And this really outlines where we've come in the field of immunization, but where we have to go. And some of the key areas of where we need to move forward are in resourcing some of these global initiatives that are making vaccines available to the least developed countries, and making sure that we sustain the gains that we have already achieved towards vaccine-related goals. So next week is Immunization Week, which we're very excited about. This is a global activity bringing together many different regions that are working to raise the visibility of vaccines, actually do activities around vaccination campaigns and activities in countries to raise awareness of caretakers and mothers to have their children vaccinated. And the Red Cross is participating in this in a number of ways. One, we're beating the drums to call attention to the importance of vaccines. Secondly, national societies in some of these countries are actually participating in their vaccination campaigns. For example, the Philippines Red Cross is participating in a measles campaign. We have ongoing activities in Kenya where the Kenya Red Cross is helping to respond to the measles outbreak, and in DRC as well. Some of the challenges I think we also want to raise awareness around are that we've made lots of progress towards vaccine-related goals, but that these gains are a bit fragile. So when we're calling for further resources to introduce new vaccines, like pneumococcal vaccine and rotavirus vaccine, we also need to make sure that at the same time the progress we've made, for example, against measles, is not lost. Right now in the Democratic Republic of the Congo, there's a large measles outbreak. There have been 16,000 suspected cases of measles and more than 100 deaths due to measles. Measles is easily preventable with a vaccine which costs less than $1. So how do we make sure that we continue our progress but also make sure we don't lose any of the really wonderful and celebrated achievements that we've made? So that's where the Red Cross will be working in the next week, in the next months, and in the next years to come. And it's important for us all to work together towards these common goals, not only to improve routine immunization, but to have the opportunity to introduce new vaccines, which can further reduce child mortality by another 25%, but also to make sure that every mother and child in communities has the opportunity to be vaccinated. So that's what the Red Cross and Red Crescent is working towards.